will just hand over now to Chrysula Arkoudis, who's going to talk about quality family-based care for integrated child protection systems in Europe. Thanks.
Thank you very much for the invitation, and this is a first-time invitation and presentation of the recommendation for me. As you know, the recommendation is, first of all, thank you for the invitation and the opportunity to discuss with grassroots people, not just policy, because the whole idea of policy is that we implement and make the changes in the grassroots level. So I thought I'd do a quick presentation and look at three perspectives. One is, what is the recommendation? Because as you know, it's a newly adopted recommendation, and it's called Integrated Child Protection Systems, how we make them stronger and develop them further. And the next, I thought I would do a presentation as well on how quality family care features in this recommendation. And then the third perspective is how to move forward with this recommendation, working with civil society and also national level policymakers. So as I said before, the recommendation is newly adopted this year in April. It is one pillar of the EU strategy on the rights of the child, but not only. It features some of the issues across all of the policies and all of the programs of the Commission. So this is why we say this is a cross-policy initiative on child protection. And protection not only in violence, but risk of violence and all forms of violence. It's not a standalone recommendation. It's a large recommendation for recommendation purposes, but it also is accompanied with a staff working document, which is very, very detailed. So you need to read the Commission recommendation together with the staff working document. And it's an end product of a very, very extensive consultation with children, with member states, with civil society, with inter-service group within the actual Commission. So we negotiated as well, and we consulted with other members, such as the Child Guarantee, not alone. So the end product is the recommendation. It's interesting to note that it's a recommendation on a global level as well. It has global consequences. The UN has also been doing work since 2012 on child protection and strengthening child protection systems. The Council of Europe has been doing it since 2009 and now is reviewing their policy guidelines on integrated child protection systems, as well as our new recommendation. So it's a global perspective at how to strengthen. And of course, EU members are part of the UN and part of the Council of Europe, the legislative obligations at least. So it's very important that our work is not standalone, it's in partnership with international organizations as well. So why suddenly we have an integrated approach? It's because we've noticed that violence is multidimensional, and sometimes particular violence against children goes unremarked, and it's not visible. So this is why perhaps in the last couple of years, and particularly after COVID, certain types of child violence is becoming more and more increasingly gaining public space. And it's also part of an approach and a way to foster a culture of zero tolerance, including corporal punishment. So what is an integrated system? So it's a system where everything runs together, because it goes by the philosophy of a functioning system. So all components of a system must work together, otherwise it's not a system. So it puts forward coherent and comprehensive disciplines working together, timely and responsive support to a violence. That not something happens and then a year later we have this case of this violence against this particular child. It's too late. So it needs to be timely and responsive. And it also looks into the system-based response, and that is operational systems. Are they working together? Is it at a national level? Is it a regional level? Is it a local level? Is it through NGO level? And of course, it's to protect all children from all forms of violence. So it's like a checklist in itself, and guiding to particular types of violence and how to respond. And of course, it takes into account all actors, not national agencies, but all the way down, including children themselves and their families. So whether that's a form of consultation, or looking into the finites, the definite finites of this process of who we're protecting and who we're consulting to protect. So in other ways, this multi-dimensional approach to child safety, to child protection, is moving away how we used to work, individually working as silos. A particular project is all about child sexual abuse or child-friendly justice, but this needs to work in consultation with all other forms, because we all know children also who get involved in the justice system also need psychological support. Are they getting this? Is the support only at city centre level? What happens to the regions? Where are we not looking into children in isolated areas and their needs? Do their type of violence becomes unnoticed because it's all centrally based? So what are we moving towards? An integrated system-wide protection of all children where everybody works together, all parts of the system work together to address the vulnerabilities, and of course create child-centred budgeting. At this stage, it's not all members have child-centred budgeting. It's a safe way of checking which domains children need to feel safe in all aspects of their life, the types of violence that need to be in place, that the system is able to respond to the types of violence, and of course targeted vulnerabilities. Do we have something in place for Roma children or disabled children, which often go unnoticed, and particularly in institutional care? The recommendation itself, I'm only just putting this up to present two types of principles that the whole recommendation is based upon. It's child protection, but also an integrated operational principles. So in a nutshell, it's a way of checking on the left-hand side all forms of violence, on the right-hand side all domains of violence, and how we check that we have everything in place and we are able to meet those needs is through an ICPS operational point. And these are only indicative at this stage, which covers, is legislation in place to cover all of these types of violences in all of these places of violence? Is there good coordination and governance of these actions, including all actors involved? Is there a continuum of prevention, protection, safeguarding, as well as rehabilitation services? Sometimes we give services only on the issue of when the violence happens, but we don't take into account what are these preventative strategies to make this violence zero. And then, of course, the type of rehabilitation that needs to be across sectors. Do we have accountability and data collecting and evidence to make the quality of our interventions in place? Have we consulted the children about the type of measures that we are implementing at national level? Family and community engagement, particularly local community engagement. And of course, do we have the human and financial resources in order to program the type of interventions that we are proposing in this recommendation? The whole recommendation is centered upon national plans without it being mandatory, because all member states do have some sort of child protection system. If they find a gap, and this is benchmarked according to the recommendation, then they need to make national plans. And these are some of the checkpoints of creating a national plan to fight violence against children. Do they have a leadership? Is there good leadership? Are the laws in place? They can articulate which areas need further and specific areas of priority intervention. They can then locate the type of funding. They can then create the type of mechanisms that have to be in place in order to collect the data and the evidence to make those referral of changes for impact. And at the same time, identify which working methods is best for them in order to reach all of these type of integrated child protection system operational checkpoints. Regarding now the second part about families, how families referred to in the recommendation. Families are regarded as primary carers and caregivers. And it calls upon member states to include families in all type of developing national plans and national strategies of intervention. The recommendation also recognised the unequal access to key services for children and their families at the same time, and calls, as my colleague Stefan said, about the child guarantee, but not only. There are other areas as well, healthcare and the housing. The recommendation also acknowledges that children with disabilities need quality family and community care-based services. What happens with the needs of children without parental care, and the whole idea of deinstitutionalization of children into family care, into foster care. And if there's nothing in place, then there's something that needs to be in place, and that's part of the programming for intervention. The recommendation also recognised children in migration situation and their need to be reunified with their families, because family, as I said before, is the central caregiver. Corporal punishment is another situation, and it's part of the zero tolerance to violence. I know in some member states they're on their way in complete banning of corporal punishment. In others there's a process on its way. I know that the Council of Europe and the UN have strategies in place in order to prohibit corporal punishment. And of course the violence in the home, which is a real big issue. And it's a form of violence that has the particularly consequences in the cycle of violence. Children that witness the violence in the home are more than likely to repeat that violence. So it looks into the way families need that special support, in particular in situations of domestic violence. I'm not sure how much time I have. Okay. Just indicative, how do we look and program in the national plans through an ICPS approach? We're currently working on some tools, how to assist member states to create this national plan. It's a step-by-step and chapter-by-chapter approach, because you cannot approach the entire national child protection system all in one go. So, and it has specific needs and ways that each member state will approach these fundamental issues of child protection and the particular violence. So what we formed is how to assist member states to rethink a child protection issue and how to incorporate that in with an ICPS approach and look at it specifically how to program interventions if they find a gap. So for example, if we're looking into national planning, children in institutional care as an example. So we've created a type of key questions that will help member states to identify a gap. If a member state identifies a gap, for example, in the green, who are the key actors and stakeholders and sectors involved in children in institutional care? It's a question that coordination is a big issue. So realigning that particular issue according to coordination and governance of an ICPS benchmark, then they start saying, okay, what is it that I have and don't have? Do I need to operationalize the child protection system at different levels to include children in institutional care? Do I review and revise guidelines? Do I have guidelines in place? What happens in institutional care? Do I develop a child protection information management system which includes the data on children in institutional care? We all know sometimes data of children in institutional care falls between the gaps. And how do I strengthen reporting and informing and sharing and learning initiatives about children in institutional care? And of course, the outcome is to deinstitutionalize children. So in a nutshell, the national plan looks at coordination, it looks at the quality frameworks, the training, the protocols and the safeguards as well that are in place, the data Again, I recommend that, stress the data and the collection and the monitoring, which is very, very important in quality programs and creating those standards. Do they have prevention? Do they support children and families, and to what extent? Do children have access to complaint and reporting mechanisms, and families have access to complaint and reporting mechanisms? And are all sectors involved? This is just, if we look at family-based care, this is also the type of approach that is also in other areas of the recommendation. What we are currently doing is trying to create a process of supporting member states to develop and strengthen the national plans through technical assistance that we will be able to provide, capacity building and promoting a culture of ICPS expertise. Providing a toolbox that will assist member states, but not only. Stakeholders who wish to apply for grants and programs will be using these tools in order to see how they can streamline their particular needs through funding, because funding is a vehicle to get things done, and we're providing as also a tool for that. And of course promoting an ICPS approach with our colleagues into other parts of the EU law, policies and the funding programs available. So basically it's a systems approach to integrating child protection measures and mechanisms, but not just only within member states, but it's also within the system of the EU and the European Commission. So thank you very much for your attention.
Thank you so much for that talk and to cover such an amount of interesting information so quickly and thoroughly, Chrysula, so thank you so much. I think it's just pretty evident to anybody who's been involved in our project over the last while of the relationship between what we've been doing and what's been talked about by Stefan and Chrysula, and the themes and the mechanisms and the possibilities for influence and I suppose maybe making a contribution to these important areas. So